right, welcome back to another episode of the Empowerful Health Podcast. I'm the host, Jeremy Kerrigan. We've got a great guest today, Travis Webb. Thanks for being on the podcast.
Thank you.
Tell us a little bit about yourself, what you do, who you are.
I'm a licensed clinical social worker, do clinical mental health. My practice is Travis Webb Therapy. Website's traviswebbtherapy.org. Been doing it about 15 years. I also run a body work group for trauma recovery purposes, trauma release exercises. So between the psychology in the chair and the trauma release exercises on the floor, we're trying to cover head to toe here a little bit, but
the whole system reset. I like it.
That's it. At least clear to some stuff, right?
Sure.
Yeah.
And that's where I met you. I was doing a lot of research into traumas and different methodologies and came across this trauma release exercises. They call it somatic release, right? Mm-hmm. It's in that family. And one of my mentors used to always call it issues in the tissues.
Issue in the tissue. That's it.
We got to get those out. And I was just fascinated by the approach. And it's been a really cool approach. I've been in a couple of your classes, a couple of your sessions, and just a fascinating way of releasing trauma and processing.
Yeah. We've got another one starting August 4th. It's going to go the 4 weeks of August, and then we'll skip Labor Day and then the last 4 weekends of September. So it's an 8-week course. You'll be getting an email today, actually, saying, would you like to join?
Looking forward to it. It's a great way to move.
TravisWebbTherapy.org will get you some info on how to join if you're interested.
This may or may not post before then, but for future references and looking up that methodology. My goal is for this podcast to reach people all over the place. So I'm sure they can look up TRE online and learn some things.
They can.
As we dive into our discussion, I invited you on because I love that method, but also because you and I have had some really great discussions about holistic health and wellness and how it all fits together. And we have a couple of user-generated questions today. I said, hey, if you could ask a therapist something, what would you ask? And one of the most common ones was, how do you define trauma? Like, what is trauma? I think the underlying question these people are asking is, have I had trauma, right?
Is that me?
Is this me? Exactly.
Trauma, that's a broad topic, as you know, and depending on the professional you're talking to, the definition can fluctuate. So, what I've found in my practice is, the DSM, Diagnostic Statisticians Manual, they're going to give you a set of criteria that maybe would tell you whether you have trauma or not. But I've found it's a lot more fluid than that. It really is specific to the individual. So maybe if we can keep it as simple as possible as far as the definition goes, this is something that maybe an event that happened in the past or a series of events, a chronic array of events that has left you on some level affected. It could be memory. It could be emotionally. There's a distress or a dissonance. It could be physically. There's issue in the tissue. And typically what you'll find is it's a combination of things. It's not always that definable. For example, if I went into my doctor and said, I've got a rash, can you tell me what this is? He might look at it and go, oh yeah, you're allergic to something. Pretty straightforward. Trauma is a lot more complex than that, especially in the psychological, in terms of psychology.
Well, there's so many facets to it, and details and ways it affects people that they're unaware. One of the things I was thinking about as you said this is there's a trend on like social media and other places creating these videos of what's a moment that changed your brain chemistry. Yeah. People talk about experiences and stuff. And as I think about trauma, and this is obviously I'm not a mental health therapist, but like it's those things that happen that you're not the same afterwards. It's altered your state of being in a way that you're either on a hyper alert, when is this going to happen again? Or there's some other like coping mechanism that comes into play. And it can be anything. I mean, two people can go through the same experience and one be traumatized and one come out seemingly fine. Yep. You know, it's really up in here what's happening to us.
That's exactly right. I mean, that's a great point. So take siblings, let's say that we're all in the car when the accident happened, or we're all raised by the same parent that did X, Y, and Z. And the way that those young brains, sometimes depending on age, but there's other resilience factors that come into play that leave one kid seemingly really affected and the other one doesn't seem to affect him. Now, that doesn't always add up later. Sometimes there's a repression.
Sure.
And this stuff kicks up way later in life. And a lot of
20,
times
30, 40 years later. Yeah.
That's where I find my clients knocking on the door is, okay, something's happening here.
Sure.
Something came up. I don't know what to do with it. And come on in. Let's sit down and let's find out what's going on. And between the approach I take in my mental health office and the approach I take with TRE, something's going to help us find what happened.
Sure. It's very similar with physical injuries. Like a lot of times people come to see me at our age, and they're like, oh, I have this problem. It started 2 years ago. I'm like, no, it didn't. It started 35 years ago when you fell off the bike or the swing set or you got the concussion playing soccer. Like that's what created this little weakness. And you were adapted. You were young. You were active. I say they were like Rubbermaid. The old commercial is Rubbermaid bounces back. Apparently, the young people don't get that reference anymore, so I have to explain it. But when we're young, we kind of bounce back really quick. But there's that little weakness in the system that just slowly builds over time, and then you add other stressors. And I think that's a big key with trauma. Is like if trauma is just isolated and it happens, and then the rest of your next several years, there's nothing major. You're able to kind of heal and adapt. You do better than if you have trauma and then something else and then something else, and it just kind of builds.
That
so
compounding
you're not able to adapt. Absolutely.
We'll talk about compounding today, especially in reference to how people mentally look at their trauma, or what they say about what happened or how they handled it. The word should comes in a lot. I should be over this. I should be fine. And I tell people, stop shoulding on yourself.
I say that same phrase. I love it.
Okay. We need some t-shirts.
Yes, don't should all over yourself. So my wife hates when I say that phrase
mine
too.
Yeah.
Okay, good.
Sorry, ladies. Sorry.
But yeah, it is that we have an expectation. I should be over here. I want to be there, and I'm not. And then it's cyclical because then people beat themselves up because why am I still stuck in this? What's wrong with me? And it's like, no, you experienced something that was hard, something that pushed you beyond your capabilities. Of course, your system's going to need some help.
Yeah, of course.
Absolutely.
Of course. Yeah.
Physical injuries are similar. Like I describe it like when the force coming into the body physically overrides, there's more than the force defending the body, you get damage to the tissues. It could be mild, it could be deathly. It literally, like if the force is big enough, it's going to kill you.
Yeah.
If it's not big enough to kill you, it's going to do some sort of damage. And it's the same with mental resilience. There's the forces inside of us, what's going on with us, the resilience to hold against that. And when the trauma is bigger than that ability to hold up against it, we're going to get some break in the system. And that's going to create some sort of pattern that's going to integrate into the system and create other mental health struggles, trauma responses, anxieties, depressions, that sort of thing.
Perfect. I love it. So true across the board. Now, and you would agree with this. I tell my clients, we'd like to think the brain is up here, and it is.
Right.
Kind of like the boughs or the branches of a tree. And then you've got this trunk, this brain stem, and you got this root system that just drapes through. I tell people your brain ends in your fingertips and your toes. And everything from the feedback up or the messaging down, it's all one big system. It really is. So I love that, what you said about the force that affects it wherever it's hitting you, whether it's physically, and we would say, or mentally, psychologically, emotionally, spiritually. Right. There's stuff that hits us, and the system goes to work to try and remediate that or cope with that. For a lot of people, it's shutting down, it's numbing. How many clients have I had over the years that have a trauma in childhood, whether it's an abuse of some sort or a neglect of some sort, the sense they're being abandoned or they reach for needs and there isn't a response.
Sure.
And as young as they are, they don't have enough cortex developed to really make healthy sense of this.
Sure.
So they kind of have this magical, fantastical response, and the messages about themselves are really, pre-adolescent. They're really young sometimes.
Sure.
It must mean I'm bad. It must mean I'm worthless or unworthy or replaceable. And man, that thing starts unraveling just like that fracture you're talking about physically. It just rides and rides, and when they come in my office, it's amazing to ask the question, what are you saying about yourself? And you get this really dirty list of like horrible messages and assumptions. And a lot of times I've got a mom who's brought their teenage daughter in, and I might say, well, look at her. Would you say the same thing about her? Well, no, she's perfect. She's glorious. And I go, okay, there's a girl inside of you that's waiting for you to talk about her that way and help her do this healing. So anyway.
It's really interesting as you describe this. There's a lot of these traumas that happen early on, you don't have the cognitive language skills to describe them. So they're purely emotional responses with no basis in the logic. And so they can be running under the surface for decades without being aware of it. I wanted to share a personal experience on this. I had trauma as a kid, and my older brother died in an accident that I kind of witnessed. I was about 19 months old. I have no memories, cognitive memories of it. Then as I got later on in life, I started having some struggles and challenges and couldn't understand like the struggle that was here, and my response was this big. And I'm like, what's going on? What's wrong? I remember reading an article about 12 signs of depression in men. And as I read through that, I became very depressed because I had all 12. Wow. Like I was shocked. I'm like, life is hard. I probably had a couple, but I didn't. I had all of them. Wow. And so realizing it was a bigger thing, but I bring this up because there was at one point I was doing some emotional processing and working with someone on it. And this anger came up. And I remember the practitioner said, well, what would this 19-month-old kid be angry at? And the motion hit, and I said, I was angry at my brother for leaving me. And as soon as I felt it, like I felt it, I knew that I'd been carrying this around for a long time. And then I immediately found it depleting, not depleting, but diminishing, because I put words to it. My logical brain was like, oh, well, of course not, and so I was able to overcome that. But what happened, because I emotionally thought my brother left me, the natural assumption is, why did he leave? There must be something wrong. So it led to this history of, well, something's wrong with me. People are going to walk away, and all this like self-conscious judgmental thing because of something I couldn't even remember happened, And I'm guessing you see this every day. People are walking around with these types of processes constantly.
Yeah. Beautiful. Thank you for sharing it. Sure. Listen to that very young assumption. I mean, what else does a 19-month-old have other than people leave out of the blue? There must be something wrong with me. See, there's parts of the brain that we might call meaning making. The brain is a very meaning making thing. It doesn't do well with a shrug and well, I don't know what to tell you. Not sure why your brother passed, for example. The brain is going to look for, search for, even without permission or rational cognitive cortex to help it. It's going to look for some way to explain this, live with this, move forward from this. Because again, there's this accident and there's this fracture in you and the body.
The world shifted and trying to understand that. Sorry, I didn't mean to interrupt you.
I tell my clients there's three big things that the base of the brain is always looking for. There's freedom, there's safety, and there's connection. And when any of these get limited, threatened, lost, then this part of the brain does this thing. It pulls an alarm. You feel an emotion, an energy to put you in motion. I tell people emotion is a lot of things, but it's at least two things. It's an alarm letting you know freedom, safety, or connection is being threatened. And it's also the energy to put you in motion to somehow cope with that. Again, if you're so young that you can't really walk through, talk through, make sense of this, you've got all this emotion, this change that you're
really
talking about.
All emotion at that point in life, right? So,
and not a lot of accurate definition of what happened and why. And so I love what you did. You sought help as an adult, and this rational cortex that's now online, it doesn't finish developing for males until late 20s, early 30s.
Sure.
It's there. But it doesn't really finish developing till late 20s, early 30s. It's earlier for females. We already knew this, it's early 20s. So here you are, this grown up now, this parent that can kind of help this 19-month-old make sense of it. And that's a really key teaching that I end up going over with people regularly is this part of you needs this part of you to be responsive, to be safe, to be caring. And help that part of you make sense. Put words to it, kind of nod into that. oh, that makes a lot of sense that I would get angry
Right.
that people leave. Instead of, what's wrong with me? Or ignore it, move on, drink through it, drug through it, check out through it.
Or zone through social media through it to just distract yourself. Yeah.
The most common drug of them all. Yeah, the screen.
Very popular right now.
It works. And that's what I tell people. We use what works. The problem with it is it works to stave off the discomfort,
right?
But it doesn't do much to solve it. It's like pumping yourself full of ibuprofen instead of going and getting some help.
Absolutely.
Working with the root.
100%. I wanted to tie two things you said in together. You touched on this briefly, but you talked about the mom bringing her teenager in and how the mom would say nice, positive things towards the teenager, but not towards her inner teenager, and this concept of the two parts of our psyche, if you will, communicating better with each other. We should treat ourselves like a good parent should, loving kindness, encouragement versus like, oh, you're an idiot. Stop making this decision over and over again. And we beat ourselves up. It's like no good parent would do that. And if you talked like that long enough, you're going to get on charges of like emotional abuse and stuff. And so as we change that healthy inner dialogue and talk nicer and kinder to ourselves and try to think about parenting ourselves, it makes a big difference.
Huge. It's where I almost universally have to start with people is if we've got kind of a cruddy dialogue going on here,
sure.
It doesn't matter how I intervene. Travis doesn't save anybody.
No.
Travis is going to put an arm around this adult part of you and say, hey, look, there's a girl, there's a boy over there. What do they need? And what you almost always experience when you, I'm talking through it kind of quickly, but when you do reach that point is you get a flood of emotions. This kid sobs up. And that's our window of opportunity. I'll tell my client, feel those emotions. But maybe you've seen this across the board when somebody starts to feel a lot of emotion, they almost always do what? Sorry.
Shove it back down.
Sorry. How many Kleenexes have been reached for while the words "I'm sorry" are coming out? I'm going, wait a second. Why don't you feel that? Let's go ahead and let that spill out of you. They haven't had somebody tell them, go ahead and feel this.
Right.
What they have heard is emotions are a sign of
weakness.
I'm still batting 1,000. Yeah. For 15 years, I've been asking that question.
Yep. Guys more than girls, right? Oh, be tough, be a man. But women too are, oh no, it's hormones. Don't be like, and then we're always putting it down and making excuses versus it's normal. Like we should be emotional creatures. Let it out.
It's healthy.
Yep.
If it is an alarm, just imagine the smoke alarm ringing in the kitchen and you go, oh, sorry. Here, let me plug my ears. Just move, talk louder. I go, no,
sure.
It's okay to hear the alarm and go respond to it.
I use the same example for health reasons. Like you mentioned Advil, ibuprofen. Like if the knee hurts and you take ibuprofen, it goes away. It's like the smoke alarm going off and you just take the batteries out and go back to bed. Like there's a reason. Why is the alarm going off?
Listen to the alarm.
Absolutely. And I liked these 3 alarms you mentioned. You said freedom, safety, and connection.
Yeah.
And I feel like that's a great definition for trauma. When you lose one of those, particularly in a dramatic way, it's going to raise that alarm and potentially can create that type of trauma. And it can happen at an early age. It can happen at 35 years old. You say you've been married with someone for a while and quite suddenly it goes a different direction. They come home one day and they're like, I'm done. I don't want this anymore. And that can be your freedom, your safety, your connection. All of it goes away in a really quick moment. It can create that trauma.
You got it. Now here's something that might both complicate and simplify it even more. It's the base of the brain that is detecting the non-rational, non-discerning part of the brain that's detecting freedom, safety, or connection threat. So it can be a real threat or a perceived threat.
Sure.
Take a haunted house, for example. Walking through a haunted house, the cortex knows zombies are fake.
Right.
Sorry, kids, if I'm spoiling Halloween for you.
Spoiler alert.
But yet we still jump. The limbic system still pulls this alarm, and we go into my safety is being threatened. Then the cortex grabs the reins and calms the horse, and we go, okay, well, no, zombies aren't. Oh, something else scares us. Now, little kids without that prefrontal cortex, without that ability to discern, they're losing their minds in haunted houses.
Absolutely. Yeah.
Zombies are real. So a lot of times people will ask, like, why am I having panic attacks in the middle of class?
Sure.
I'm not really being threatened. It's not like there's an active shooter on campus.
Right.
And I said, careful. Remember, your limbic system is calling up some story, either from the past or from the present. I mean, is a classroom a place where a limbic system perceives a threat to freedom, safety, or connection? And the answer is, well, yeah, it could.
It can. Yeah,
those
absolutely.
desks can feel like little prison cells, and the people around me don't like me, and I don't fit in, and I'm not enough. And the alarm starts ringing.
I'm going to fail this class, and then that's going to mean this, and it's, yeah.
There's that meaning maker.
The catastrophizing. We had a question about catastrophizing, and that's what it is. Let's take this to the nth degree. And often it comes because at some point we lost freedom, safety, or connection, and now our brain's like, okay, I don't want that to happen out of surprise again, so I'm going to be on hyper alert, always looking for it. And if I plan the worst case scenario in my head, then I'm ready, or it's not going to happen, or something like that. I saw something the other day. They're like, hey, worry works because 100% of the things I worry about don't happen. You know, it's that idea of, oh yeah, absolutely. We think if we just plan enough, it won't happen again, versus like taking care of the inner body and making sure it feels that, or when we do perceive that we're able to acknowledge and process it. Because the vast majority of our brain is not cognitive. We're not aware of what it's doing. It's that we call it like what they call the mammalian or the reptilian brain, the alligator brain, you call it the horse versus the rider.
Yeah. So one way to think about it, your brainstem, we might call that the reptilian brain. It's all about survival, right?
Fight, flight, freeze, all this sort of stuff.
Reptiles will eat their young if it means surviving, right? They don't think things through. They don't feel like, I come up to that limbic system, and that's what we would call the mammalian brain. I like to call this the horse. And then this cognitive, rational prefrontal cortex, which is the last part of the brain to develop, we might call that the rider. So you've got this human rider sitting on this horse. And I love to ask people, if we went to the rodeo and I looked out and I said, hey, who's in charge out there, the rider or the horse? They go, oh, well, it should be the rider. And I say, assuming the rider has trained the horse, and assuming we have a rider, it's developed, and assuming the horse is calm
and not threatened, or
if the horse gets spooked, I'm sorry, who's in charge out there? You got a 1,200, 1,700 pound horse throwing a 200 pound rider. It's not a fair fight.
When you get these people that have been riding horses for decades, they're still thrown from the horse because you have this powerful beast underneath that has its own brain that it's going to ride.
I think that's what mental health is it's becoming a competent rider that still knows this thing is a horse.
Right.
Train the horse, learn to stay saddleback.
Sure.
But don't assume that you've got this thing. I mean, one of the questions that we saw is, how can I stop experiencing triggers? And I kind of looked at Jeremy and I said, good luck.
Right.
It's like telling a horse not to be a horse.
Maybe after you die, you're going to have less triggers, right?
Yeah, a lot of drugs. Maybe you won't get triggered anymore. But
But you also won't live your life. You can numb the whole system and you're not going to be living and thriving in this world. This is a really fascinating point because oftentimes if people have chronically struggled with mental health issues, they'll make progress and then a trigger will happen. And it's like throwing the hands up, upset, like, why? But it's there's this part of your brain that's built in. Its job is to protect you at all costs. It overrides the rest of the brain. Last week I was hiking and I'd stopped in a spot, took a couple pictures, and then I took a few steps. And right where I was standing, this giant rock fell like 40 feet. It was about this big around, so it would have taken me out. It fell and I heard it fall, and I'm not a runner, but I ran. The
horse spooked.
The person watching me was like, I've never seen you run that fast in your life, but that horse spooked. I didn't think about it. It wasn't like, let me see the trajectory. I hear that here. Where's it going to fall? None of that stuff was there. It was like, get away right now. And that's the flee response, right? There's the fight where you turn around, you're going to fight this person, or you're yelling and screaming at the person in traffic. There's the freeze where something happens and we just do this and we stop moving. Those responses are really powerful. Like I love this 1,200 pound horse thing. They're going to happen. It's like, what do you do when it does happen?
Thank goodness your horse doesn't stop to ask your rider, what should I do about this rock coming at me? Should I punch it? Fight? Should I hold still and see how my skull does? Or should I just bolt? And
it just responded and saved my life. It was fantastic.
And so we want to make meaning of why we fought, why we fled, why we froze. The freeze response is a really cool one because a lot of people coming through my door and yours too, they're frozen,
Sure.
they're numb, they're dissociated, and they want to ask that question, what's wrong with me? Think about it like this. You've got fight. If you can fight, the fight response is going to require an energy to put it in motion. So there might be some frustration that eventually builds to anger, that eventually builds to rage. Road rage is like, I'm going to hit you with my car to remove the threat.
Completely irrational, but yeah.
If you can't fight, then you tend to flee.
Sure.
Running from a 40-pound rock, falling 40 feet is a great strategy.
It worked very well.
Don't fight, don't freeze or flee. That's going to require an emotional charge. And it might start simply with some worry or some fear. Eventually you've got panic.
Sure.
A panic attack is telling you get out of the situation now.
Sure.
Now, one thing to think about, just imagine that rage and panic kind of sit right here beneath this threshold.
Okay.
If raging or panicking, fleeing doesn't work, then the nervous system will eclipse that threshold and we go into a freeze response. Freeze is kind of I can't fight this.
Sure.
I can't run from this. Now, there's people listening to this podcast that are going to tear up right now. They're going to go, oh my gosh, that's me. I feel like I'm stuck. Your nervous system knows what it's doing. If it can't remove the threat or remove self from the threat, then it goes into this beautiful state of dissociation to keep you alive, but not distressed.
Sure.
Think about it like this. If you hit your thumb with a hammer, ow. I mean, this alarm rings. If you hit it again, oh my gosh, ow. If you hit it again and again and again and again and again, you see where I'm going with this?
Yep.
Eventually you're not going to feel.
The brain just shuts all that off.
It's too distressing.
Sure.
So some of you that are living in chronic states of distress and you keep wondering why you dissociate, why you numb, why nothing seems to feel good or pleasurable anymore. We've got some work to do to get you back beneath that threshold, back online where this autonomic nervous system kind of kicks back in, sympathetic, parasympathetic, right? It kind of kicks back in and, be prepared when you come out of numb back into feeling.
A lot of feelings.
Look at what you encounter first, rage or panic. So a big part of our job is knowing what to do when the rage flares up. Your anger flared up. You came back online. You felt something that was beneath that threshold. And you know, it's helpful to have somebody that knows what to do with that sit with you.
Absolutely. But like you were saying, there's this flood of emotion as you come out of non-feeling and numb that you're going to feel. And a lot of people get scared of that. But once you let your body feel those emotions, process them, especially with some professional help, then you're able to start working back through and get your body and your brain, more importantly, your brain back into a calmer state where it's like, okay, I am okay now. I've got some of that freedom, that safety and connection back, able to start thriving and just instead of just surviving this life.
You got it. Yeah, that's it.
A big question that comes at this point is like, you know, trying to process these things. What's the old phrase? You can't fix the problem with the same brain that created the problem. You know, you need this professional help. And I know a lot of people are looking. I know most therapists and counselors I know are busier than they've ever been, booked out of ways. What are some ways people can look for resources and find a good counselor? And you're going in there and it feels like you're going to open your soul to someone. People are very nervous about that. Like, I don't want to talk about all these issues. I don't know who to trust, who to go to. Like, what are ways people can seek out and find a good person to fit? Especially given the past generations' dialogue on counseling. I remember asking my dad as part of bless my dad's soul, love you, Dad. One of my first assignments in college was to ask your family of origin what their perception of mental health therapists was. And my dad said, I think mental health therapists need mental health therapy. They're crazy people. And, sure.
You know, that's kind of an archaic approach to it. The upcoming generation is so much more open to it. They don't look at it as something that's stigmatized or you need to keep quiet. They're open about it. How to find a professional that can go in a lot of directions. Most people, they jump on, they search mental health therapist near me. Sure. Now what I would recommend is jump on that person's website, look at their bio and look at the modalities that they offer. Do a little research on the modalities that they offer, because there's a lot of different roads that therapists take to help you get to this spot I'm talking about. Right. It's not just talk therapy for some people. For some people, they'll tell me the gym is my counseling office.
Sure.
I mean, movement does so much for them. And I high five those people. Good. Keep going to the gym. But if you find this chronic alarm keep ringing and you just go to the gym and work it out, and then it rings and you go to the gym and work it out, well, maybe come in and talk about some of this stuff that maybe the gym isn't able to resolve.
Sure.
There are others that sit in talk therapy for years, and I tell them, you need to start moving.
Yeah.
You need to see a chiropractor.
All of these. Yep.
Find what your nervous system is telling you, and then kind of pay attention to what really helps you feel better. Quit searching endlessly for every modality that could. Find a couple of things that really help, and then stick with it.
I was just going to say that. People bounce around. Oh, I did 2 sessions with this therapist, or I tried this gym program. I did this for 2 weeks. And it's like, no, like you've had this trauma maybe for decades. It's not going to shift in 2 weeks. It's not going to shift in 12 sessions sometimes. It's going to make a difference. Right. The big thing is you're going to see which direction you're going, but it's going to take work to get there in time.
You got it.
Patient with yourself.
Let's go back to the body for a second. If I go into a personal trainer and say, look, I want to look really good by Christmas. And he says, okay, let's get you started. And he has me doing some ab exercises and treadmill. And 2 or 3 days later, I look in the mirror and I don't have a 6-pack yet. And I go, come on, like, what's going on? He's going to look at me and say, are you crazy?
Right.
Stick with it. Like, this takes some time. Hard is healthy.
Right.
Hard is healthy. Quit looking for quick, cheap diets to get you in shape. Quit looking for quick, cheap modalities to get this trauma resolved. Find a person you feel safe with, and then commit to some time. And that can mean, a few months for some people. It can mean more for others, but give it some time.
Looking at the whole picture, taking care of the other aspects. What you're eating makes a difference in your mental health. Yeah. What exercise you're doing, how you're talking to yourself, all those sort of things build into that. Another point I was going to say too is I like to ask the question to people, what would your teeth look like if you went to the dentist for the first time at 45 years old, And they're like, it's a scary thought and it would be really expensive. Whatever it is, it's going to cost a lot of money because dentists aren't cheap, and it's that same idea as people, we put off our mental health. The younger generation is doing a lot better. I know so many young people who go to therapy on a regular basis, who find great resources, but some people haven't. I had a patient here who was recently diagnosed with anxiety in his 70s.
Yeah.
And is starting to work through it. And it's like, there's a lot of history there. It's going to take a little longer. You're going to be more patient you have to be more patient with the body because you've waited a long time, and it's better now than never. But also understanding like, hey, I start this at 45. I have 45 years worth of stuff to work through.
Those neural pathways have become neural freeways, right? I mean, we got 8-lane highways, and it takes some time to kind of break that up and challenge some of that, and then implement some new approach.
Sure.
Yeah,
I think this kind of rises to one of those fears people have about therapy is that, oh, I'm going to go, and then I'm just going to always have to go, and they're going to make they're going to tell me I have all these problems, so they'll keep me coming. It's good for business. This is a cheeky little thing, but any response to that? What we're talking about kind of answers that, but.
Yeah, I maybe to stick with the cheekiness of it. I've told a client or two, look, I'm the only guy I know who's working myself out of a job. Like my job is to help you acquire a set of tools, build resilience, change some of those neural pathways. Sure. I want to help you train your horse. I don't want you to feel like I'm a permanent fixture in your life.
Sure.
With that being said, I'm here when you need me. Now, I have clients that check in annually with me.
Nice.
Yeah, I've got a client, she comes in once about every 9 months to 12 months and just says, I'm just checking in. Nice. It's a dental checkup,
Absolutely.
And I say, it's so good to see you. Let me see how you're using the tools. Let's look at the treatment plan we developed. Sure. How are you implementing that? And those are people that typically are riding very well saddleback. And
nice.
Yeah.
I like the concept. I tell people this of like, we have this fear of being dependent on something or someone else. It kind of goes that freedom, safety, connection where we're scared. And so we don't want to be dependent on something, but we look at like certain health modalities different and say, I'm not dependent on it. I'm utilizing it to live my best life.
Yeah.
Because people make it all the way through this life without ever visiting a therapist.
Yeah.
What if they didn't? What if they were able to use some of these tools and use people like yourself to get more out of life. And so I'd like to think of it like that, as something that I'm utilizing to get the most out of life and to continue to propel myself forward. Also to correct patterns. I'm a dad of 5 kids. If I can work on and break some of those family cycles of things that are going on in the family and have been for generations, how much more wonderful could that be?
Great point. That's something for people to consider. There's a great book called "It Didn't Start With You."
Nice.
And his proposal is there's this transgenerational epigenetic inheritance.
Sure.
In other words, you're not just working with your life and trauma. Right. You got your parents, your grandparents, and your great-grandparents. He says even to the 3rd and 4th generations, if I remember him right. So, dang it, if dad went through something really tough, there's a potential for your nervous system to have a heightened response even without an event in your own life.
Absolutely.
And so again, don't let that freak you out. Just remember, this is a little bit like, maybe I'm predisposed with the slower metabolism to put weight on. It's kind of, okay, we can get around that.
Our genetics play a role, but they don't define our lives. I have a funny experience on this. So my great-grandmother had a pretty rough life, but she was still alive when I had my first kid. So we had 5 generations of the family alive at the same time. And because of her rough life, my grandma tended to be pretty negative and would complain a lot. And I remember one day my grandma, who was her caregiver, was talking to me, and she was just so done. Like, my mom is so negative. She complains, and she was just complaining about it, and going off about how negative she was and how draining it was. And that same day I talked to my mother, and my mother was like, "Oh, my mother, she complains too much. She's always grumpy," is going off about the generation above her and how negative they were. And literally all this happened the same day. I'm not even exaggerating. My sister and I were talking, and my sister's like, "Mom is driving me up the wall. She's so negative. She complains all the time." And I'm like, you can't see this. We don't usually see that. We don't notice that family pattern, that tradition handed down. That's like, that's what we're doing. So when I find myself complaining and my wife lovingly nudges me sometimes like, "Hey, maybe you're complaining a little bit. Maybe we should break this family pattern, and correct that." So the work we're doing is helping those people, but it's also, if we can break that cycle, give our kids better tools, why wouldn't we? As a good, loving parent, why wouldn't I take the time away, spend the money on myself to go see a counselor, to go do therapy, so that I can come back home a better dad and better ready to serve those around me?
I had a great therapist tell me, we're just purifying the stream.
There you go.
My son is going to be a way better dad than I was. And I'm not saying, and I'm a better dad than my dad, but we certainly learn from, if we're accountable creatures, we will kind of take on this stuff that we've inherited or that we've experienced personally and do our work around it. We don't want to look at this as like, what's wrong with me? This is kind of an opportunity in life to put some muscle on, to feel good.
Absolutely.
It's a good opportunity. It's a positive thing, and we're trying to get rid of this old idea that, gosh, you need to see somebody. That's bad.
Right.
No.
Oh, something must be really wrong,
Come experience a transition.
But at the same time, everyone could use therapy. I'm a big fan of saying that because we all have stuff. This life, this world is a kind of a hot mess sometimes. There's a lot of problems, and you're trying to deal with these with the limited tools we have. Why not go learn tools? Why not be able to have someone help and support you along the way?
Yeah. Beautiful. It's an amazing experience, even if you don't have something massive pulling you on. It's like saying, who needs exercise in life? Well, it's like, yes, all of us. Maybe somebody's got great genetics, but still, does exercise hurt anyone, or does it help everyone?
Right.
Yeah. Open this stuff up. Talk to somebody about it. Somebody that knows what they're doing, can validate this vulnerability that you're feeling, and I don't know. I love it. I love the helping world. Love the helping profession. So
it's so great. And I'll close up with a little thought here. You mentioned earlier about finding counselors, finding therapists, going on their websites, reading about their modalities, reading about their focus. That's how I've found a lot of people. That's how I found you. I looked at your website, loved the types of things you were talking about, what your modalities were, and was able to attend your classes and utilize you as a great tool to help me better serve my patients, better serve my family, and live a more full life. So there's what like Google searches. I think Psychology Today also has pretty good lists of different people on there. Again, looking at people from different resources and avoiding that stigma.
Yeah.
Looking and getting the help. Guys, particularly, I'm sure more of your patient clients are women than men, but every guy I open up to and talk about this stuff with has stuff going on. So like if there's a guy listening, like take the step, be the man, like we say, be strong enough to say you're not strong and you need help.
Yeah.
That takes much more strength than faking like we're strong and pushing through it. In my opinion.
I never see crazy people in my office. It's funny. I can't imagine sitting with crazy people all day. I go, I don't. I work with accountable people all day.
I like it.
I work with people that actually put on their boots and say, I got some stuff to work on here.
Absolutely.
I love it.
It
my
takes a
clients are
lot
amazing.
of courage to make that call, to walk into an office the first time. It's a very strong thing to do. So if people are on that first step, that's amazing. Keep going. So,
I love it.
Thank you so much for being on here today. This is a
you.
great chat. Travis Webb, traviswebbtherapy.org. I think you've even got some great old videos out there sharing some information.
I do, right? Yeah, they're out there. Yeah, they're out there.
He's a great wealth of knowledge. So thanks again for being on here.
Thanks,
Travis.
Jeremy. Great being here.